Hey you guys, welcome back to Phil and Alex 2. For those of you who don't follow us on our blog channel, we actually are sharing about our IVF story and our journey that we've been going on. But today I want to talk to you a little bit about what medications look like for a frozen embryo transfer. So for today, it's technically day 3 of my cycle, and this is when I start my medication. So this morning, we're going to be doing a couple of meds, and then the other meds will come back in a few minutes, and we will go ahead and check those ones out too. So I'm gonna actually start with these 2 estrogen patches. These ones you just put on your tummy, and we'll do that in a second. And then the other thing is we're gonna be taking doxycycline. This is an antibiotic that I'm gonna be taking twice a day for the first week. And then this evening, we are going to be taking a baby aspirin, dexamethasone, which is a steroid, and then some estrogen injections. Yes, I have to actually take this, put it inside of this needle, and my lovely, wonderful husband is going to be injecting it into my
Tushy.
I'm trying to not say that.
Tushy. Tushy.
Philip wants me to tell you that I'm going to be injecting it into my tushy, but it's like your lower back, upper muscle. It's your gluteal muscle is where you're going to be injecting it. And we will be doing that in just a few minutes when we come back tonight. But this morning, let's start with the estrogen patches. So I've never done these before, but my doctor was talking about how you want to rotate spots. You don't want to keep them on the same spot. So she said, you know, just take the 2 patches. They want to be below your belly button, and then we're gonna start with 2 on one side, and then in 2 days, we're gonna flip them and we're gonna put 2 on the other side and go back and forth every other day. Okay, so now that I have my patches on, I'm going to be taking my antibiotic. I am going to be taking 1 this morning and 1 this evening. So I'll move it from this side to all of my night medications all over here. And then actually, Philip has to take 1 too. For 1 week, I have to take this morning and night, and Philip has to take this morning and night. I think it's because when you're married, sometimes you wanna make sure no one has infections. So that's what this is for. All right, you guys, we will see you back in just a few moments. All right, you guys, so it is the end of the day. It is in the evening, and it's time to do my second round of meds for the day. So I am going to be taking my doxycycline, which is the antibiotic, and I get to take it, and Philip gets to take it. Then I'm gonna be taking a baby aspirin. Then I'm gonna be taking dexamethasone. Okay, so let's take these 3 pills before starting the injections. The little pill got stuck on my tongue, it wouldn't go down. Okay, so everything is done. Now, the thing I've been dreading, and I'm just like avoiding it at all costs. So I'm gonna be taking estradiol valerate. And so for my protocol, I'm gonna be taking 0.2 mLs every other day. So for right now, that's my dose. Okay, here's the problem, guys. I heard progesterone is a little thicker, but this is still an oil. So it's all mixed. I don't have to mix anything or do anything. I just have to draw it up and give it. For those of you who are coming here and have already done IVF and you've already done this, you know, maybe it's not that big of a deal, but for us brand new that have never done this before, we can be a little bit nervous because I'm not sure what it's gonna feel like. I'm not sure how I'm going to like it. So I am going to have my wonderful husband come help me do this. And yeah. I'm gonna show you guys a trick that a girlfriend of mine told me to do and see if that helps. Okay, let's get started. So we are going to draw up the medication. There are 2 types of needles. When you look at it, the thicker one is to draw it up, And then the not as thick one, yet it is still thick, is going to be used for injection. I'm just gonna open up, set it on the table, and open it nice and where I don't touch it, and just leave it nice and clean. I'm gonna open up the top of my estradiol and kind of pop off the top. So it should be all clean and sterile since it's brand new, but just by habit, it's always a good habit to alcohol the top, clean it off, rub it for a good 10 seconds, and then let it dry completely. So the way that it disinfects is the actual like drying process. So that's how alcohol works. So then I'm gonna open up my big needle, which is a 18 gauge. And I can grab it, it's all in the casing. And then I'm gonna grab my syringe, but I don't wanna touch the tip. I'm gonna just touch back here on the actual syringe part. So these two parts, the needle and the syringe, are completely clean. I haven't touched them. And now I'm gonna put them together and just screw it on. And now I have a good full needle ready to go and draw up my medication. So I am going to pop off the top. I am going to set this top down because I'm going to reuse that. And I'm gonna go straight down into my vial. It's a thick needle. Flip it over. Make sure your needle's in the actual medication part and pull back the point two. It looks like there's some bubbles coming with it, so I'm gonna kind of push those back up, kind of shake it around and try to pull back. And I'm gonna pull back to my dose without having any bubbles in there. So I'm gonna put it back down on the table and pull my needle out. Don't poke yourself. And I'm gonna use that lid and I'm gonna put the lid right back on because that's the way you're gonna be able to unscrew it. If you try to unscrew it without the lid, it's very difficult. So I'm gonna set this down and open my other needle. So now I have my 22 gauge, which is a lot friendlier, nicer needle in my opinion. And I'm just gonna open that one up. Again, try to keep it clean, not touch it. And I'm gonna grab the plastic. If you're comfortable, you can pick this one up and switch it. If you're not comfortable, you can pick up your syringe, unscrew the needle that you don't need to use and set that one down, and then just pick up your other needle, and both places are still clean. Both of these tips are still clean. And then I'm gonna be able to screw it on directly. It hasn't touched anything. And you're pretty much ready to go. I would just double check and look at your medication and make sure you're perfectly at the dose that you want to be at. And depending on your dose, it's gonna change throughout your cycle, and just depending on what your doctor recommends, it's gonna change your dose, but just to make sure that you've got the right amount drawn up and ready to go. And then you're ready for the fun part. Okay, you guys, so I'm getting ready and I'm telling you the trick. Hi, honey.
Hi. First off, I'm so proud of you.
Thank you.
You're a warrior.
Okay, your turn.
Little blue pill.
Your antibiotic. It's like to prevent any kind of infection and protect your flora and all that good fun stuff. And because we're married, they would need to make sure Philip doesn't have anything that he can give to me, if you know what I mean. Okay, so you guys. There's like a way that you put your finger on your hip and then your thumb goes on your butt, and then like it's like the muscle right in the middle. Mm-hmm. Well, my doctor's office drew on me in Sharpie.
And it's awesome.
And so
she has bullseyes on her butt.
I have bullseyes on my tushy, guys. So.
Oh, did I say butt? I meant tushy.
Here's some alcohol to keep this clean. Okay, so here's the trick my friend told me. So she would stand up, she would lean on her kitchen counter, and she would not stand on the foot that she was giving it. So if we're gonna give it on this side, I'm gonna stand on this foot, like, and totally have like no weight so you don't have any tension. And she would bend over, and then she said she would drink like some orange juice. So that way it made like her mind like think of something else. I don't like drinking juice. So I'm going, other than like the juices that we make. So I'm gonna just drink water and try to think about drinking the water and not the fact that my husband is about to stick me with a needle. Sound good? Here, there. I have to get really used to this, so I can't freak out like I did. Okay, the estradiol, which is like the estrogen, is every other day.
Oh my gosh.
When we switch to progesterone, that's a whole nother story for a whole nother video.
Which you will do.
Which we will do.
Y'all, let me just say to each and every one of you that are doing this.
Proud of you.
Proud of you. You're a warrior. You are almost there. And I hope that you have some good company, like me, to shoot you in the tushy with these needles.
Okay. All right.
You're sweating.
I'm sweating. Okay.
She's perspiring, everybody. This thing?
Yep.
So, question. Your hip is like here.
Yeah, that's a bone.
Am I going in this way?
The circle.
I'm going down.
You're going straight.
Straight.
Into the muscle. Yeah.
Like that.
Poking it even hurts. Okay.
I'm confused because this is your bone.
Up there's my bone.
You sure they didn't draw this too high?
No. Where you poke right there was my bone. That is muscle.
You have enough muscle to clear this long needle?
Yeah. Okay, but I want...
Might need to bust out some power squat. Do some squats soon so you can get some more muscle, because this needle's a bit longer than I think your muscle is.
Ooh. Okay, so I want you to grab, like do the whole finger and thumb thing. So you have to do it with that hand.
Yep.
And then I want you to like hold on. And then when she said when you're pushing it in, you can either let go of this, you can either hold on to the skin or you can let go of the skin.
And then jiggle it and then...
Okay, but you're pinching, that hurts.
I'm trying to make more pain than the needle.
That is the trick. If you make more pain on my skin, then I don't feel the needle as much. If that makes any sense. It almost like distracts your nerves. Okay, so I'm gonna be focused on this. I'm standing on my other leg, which is already tired because I've been standing on it for like 5 minutes. Oh.
I have a question. How does this needle come off?
What do you mean? Oh.
Oh, okay, got it. I was twisting.
Don't twist. Don't twist. Twist it back on.
I did. It's
very
very,
tight, and then you just pull it straight off.
Okay.
Okay.
So this needle is like pretty much a needle that has the size of number 2 Ticonderoga pencil lead. It's gonna go in her tushy.
Okay, so I'm lifting up
right
my
here.
leg.
Lift up the leg.
My leg is off. It's on the ground, but it's like there's no weight on it.
So now I want you to start singing your favorite song.
Okay. Maybe that should be a tradition that every night you guys can hear me sing a different song. Okay, pick a song for me to sing.
Baby Got Back.
I don't know that well. Like an actual like.
How about you guys sing Baby Got Back while I stick this in her baby little back? Ice baby. Just start singing ice baby.
No. Tell me a different song to sing.
Moana.
I've been staring at the edge of the water.
Can I do this?
I can remember.
I love my wife.
Really
She's the best.
I wish I could be the perfect daughter, but I come back to the water, no matter how hard I try. Oh, I don't know.
You're doing great.
Return I take, every trail I track, every path I make, every road leads back to the place I know.
You're doing awesome. Where I long to be. See the light in the sky and the sea.
Okay, let's pick a different song. Different song. I don't want Moana to be tainted by injections.
It is done. You did amazing!
You guys saw me flinch. I definitely flinched.
You did a great job.
Let me pull my pants up. Hang on.
Wait, you want to wipe it?
Wipe it? Why? Is there
The
stuff
blood.
coming out?
It was soaking with blood.
Seriously?
I was just kidding.
Oh.
She did so good.
Okay, so you saw me flinch. I definitely flinched, but singing actually helped. So I don't care if you're a good singer.
Welcome.
I'm like not
Yeah.
a great singer, and oh, I can feel it in my tushy. That's weird. That's weird.
In the comments below, let us know if you've done this injection and what song you sang.
Yeah, sing a song.
Sing a song, and then tell us what song you sang, and maybe we'll compile a playlist together.
Yeah. It wasn't horrible. It wasn't horrible. How hard was it to push it in?
Not that hard at all. She has a great tushy.
Okay, so like pushing the actual oil wasn't that hard?
Oh, no, not at all.
Okay, that's good. So the estradiol, it's not that bad.
I will say this. May I give some instructions?
You can interject.
So I squeezed her tushy, I put the needle in, and then I let go gently here, stabilized it with this pad of my finger, and then, once I got up here, I squeezed it in.
Well, you could also flip your hand over and squeeze with your thumb. Like if you want, once you went in, you can like hold on to it and then squeeze with your thumb.
But you didn't feel the transition, did you?
I think I did.
Did you?
It's fine.
We'll get better at that.
It's fine. We'll practice. So this estradiol is every other day. Same with my 2 patches. They already have blue around them from my jeans, but they you can go on in the shower with them. You just wear them 24/7.
Perfect.
And I change them in 2 days, and I do this every other day.
You're a champ.
Wowza.
Y'all, you are amazing.
Some doctors only do the patches and don't do the estrogen injections, but I have to do both.
I am so proud of you.
Thank you.
I know it seems like it's difficult at this point.
It's just annoying.
It's annoying.
It's just like anyone who's walked the road of infertility. This is just annoying that like our bodies aren't just like doing what they normally do, what they should be doing. But you know what? It is what it is.
Yep.
We're here, so let's make the best of it.
Yep.
Now, take your sharps. Okay. Thank you guys so much for watching. Hopefully you got a little bit of encouragement. If this is the journey you are on, if this is not the journey you're on, here's a little bit enlightenment of what kind of goes on behind the scenes of IVF and how much people really work to get their baby here.
Yeah.
If you guys haven't already, go check out our vlog. We film videos on a regular basis. And we will see you guys in our next video.
Bye.
Bye.